Hospital workers and one of Western New York's largest employers have one more day to negotiate a new contract before their extension expires tomorrow. Then workers could authorize a strike. Nearly 8,000 Kaleida Health workers are demanding improvements in staffing levels, as well as benefits and wages that they say will recruit and retain more staff for patients. Earlier this week, the Joint Negotiating Committee called for a strike authorization vote, which will be held July 8th through the 10th. Tonight, 7 News reporter Michael Schwartz is sharing the voices of these healthcare workers and explaining how possible Medicaid cuts in Washington could be impacting negotiations.
Announcing a strike authorization vote at Kaleida Health.
Thursday's announcement by 1199 SEIU and CWA hospital workers now allows nearly 8,000 hospital workers locally to make a determination if they plan to strike next month or not over inadequate wages and staffing at Kaleida facilities.
And I believe we can do better.
Mary Kalerski is an experienced registered nurse and educator at Buffalo General. She says new staff at Western New York's largest employer are becoming easily overwhelmed.
We are losing great nurses because the current system isn't adequate to support their progress.
In a statement, Kaleida Health said, "We are committed to do all that we can to achieve a fair contract that rewards our current employees and puts Kaleida Health in a strong position going forward."
We are well aware during these negotiations that we have these looming Medicaid cuts in the background.
Kaleida's president and CEO said if these federal Medicaid cuts do occur, Oishei Children's Hospital, where most patients rely on Medicaid, could lose $65 million per year in funding.
We have two congressional representatives, Claudia Tenney and Nick Langsworthy, that are voting for these cuts.
Langworthy firing back in a statement saying he's not looking to cut funding, telling me, "We will root out the fraud, waste, and abuse that steal precious resources from the most vulnerable, and we will implement a fair, part-time work requirement for able-bodied, working-age adults without school-age dependents. This is about restoring accountability and basic fairness for those who have the ability to work but choose not to."
The reality is, how can taking away $65 million from safety net hospitals be waste, fraud, and abuse?
Both sides have until 11:59 Friday night to make a decision to either extend the current labor agreement or let it run out. Michael Schwartz, 7 News.